Hi, I'm Sarah Edwards. I believe that leadership is a privilege. It's a privilege that carries with the responsibility to inspire others and to direct them to obtain the vision and goals of the organization. I believe that the most important job of leadership is to develop leadership and pride within all levels of the organization. I want every individual in the department to feel proud of what they do, understand how their job contributes to the overall department, and feel that in some way they too can provide leadership. I believe that leadership is not the job of putting greatness into people, but rather the recognition that greatness already exists. The role of a leader is to provide the grand challenge, create the environment, and invest in the individual to inspire the greatness to emerge. Leadership is about inspiring a group of individuals to achieve extraordinary things. I will lead a team with compassion, confidence, and motivation, all to meet the needs of our team and the organization. I will encourage and support my team to reach their potential by providing them with challenging and rewarding work. If I were hiring for this position, I would look for someone who is goal oriented, good at communicating, and a hard worker. I think it's important for people to know where they want to end up and to have a rough plan of how to get there. Anyone in this position has to be able to communicate with coworkers and patients. So that's why that's important. Also, someone with knowledge and skills in what we do in healthcare, a good team player with positive attitude, who is willing to learn new things in the organization, and willing to take challenges with high aspiration to grow within the organization. First, I would consult with the HR about the appropriate protocol. Second, I would inform the employee of their termination, stating the things that they did well along with what they did poorly. Finally, I would allow them to ask any questions to ensure that any confusion or issues were addressed. Because usually when this happens, they're ideally, firing someone should be the final installment in a conversation that has been ongoing. The employee has been clearly told about the problems and what needs to be changed. And if that change doesn't happen, then there's the warning, the written warning, and then probation, depending on the protocol of the hospital. And when a termination conversation happens, it's more of a wrap up than anything else. It shouldn't be a surprise to the employee. If I want to motivate my team members, first, I believe we should understand them personally, not with just work, but with their family and how they're doing, their well-being. And this will boost up the confidence between the team members and the team leader, because when you treat them as a family, you can share thoughts of them and talk to them and build rapport. Team building events has always worked in my experience. One time we went to a place where it's called Escape. A group of us would go and split up into groups, and in order to get out of that room, we had to solve problems and work together. And it's a great team exercise, and it builds trust and help us communicate with each other, and it's really important. Team building events has always worked in my experience. In my previous experience, we went to a place called Escape and split up into groups. And the winner will be whoever can escape the room the fastest by solving problems together. In order to solve the problem, we have to communicate and trust each other. And it brings a great result, strengthen the relationship um, with these small events. an outing. I also like to have a clear system of rewards. All employees should know what they'll get if they achieve certain results in their job, like an extra day off, some form of like material rewards for the work well done, and like events for taking the whole family out at the baseball game, where we would um, have a section for the employees and their family members to watch the game. I would say my greatest weakness is my tendency to get caught up in the small details. For example, sometimes I get behind on my workload for my therapies because I spent too much time documenting the care I delivered in the computer system that we have to push around now, and I'm learning. I'm learning to say what needs to be said without adding any extra information that really isn't important to the patient's care, and that has helped me get back on track. Um, by taking this class, I've learned a lot about leadership. Um, Effective leadership is an important element in a successful business or organization. The authors of the Leadership Challenge describe the book in a very clear way that it's the behavior of the individual when guiding the activities of a group toward a common goal. Healthcare organization is very, like it plays a very important role for that. And there's 5 excellent. By taking this class, I've learned a lot about leadership. Effective leadership is an important element in a successful business or organization. The authors of the Leadership Challenge describe the book in a very clear way that it's the behavior of the individual when guiding the activities of a group toward a common goal. Healthcare organization is very, like it plays a very important role for that. And there's 5 excellent. I've learned a lot about leadership by reading the book, The Leadership Challenge, and also posting on the discussion board has made me understand about management and leadership, what's the difference between them, and also about modeling the way, how to set examples for those who work with us, under us, and how to get them to follow you, which can be helpful in our field in healthcare. Also, as leaders, we have to learn how to use powerful language, positive communication style, and live by examples in order to enlist others to follow the ideas and the vision that we have for the organization. As leaders, they help people cope with stressful situations by building a sense of control, by choosing challenging tasks within a person's skill level, and building commitment by offering rewards, and building the attitude of challenge by encouraging others to see as change as an opportunity. I can take this, learning this into my work with what I do at night shift, where as a shift lead, you just have to trust people and to do something that they haven't done before. As an example, working with new equipment, let them go and see what they know, and if they have questions, we're there to help them and guide them, so they can build confidence. And after taking this course, it made me understand that in order to enhance my own personal leadership development, I need to challenge myself on a daily basis. By defeating the small challenges daily, I will continue to grow as a leader in my organization and as a respiratory therapy. One example of a small challenge that will be beneficial would be to practice accepting help from other people. From other assessment, I've learned that I have trouble accepting help because I feel like I'm a burden or taking up too much of their time, but in fact that it would help with the patient care and with myself. And one example of a small challenge that will be beneficial would be by practicing how to accept help from other people. I've helped other people and I'm happy to, but yet I can't. I feel awful to ask others for help. So by challenging myself to accept help, it will open up time and be beneficial to patients and their care. Another way I can develop my leadership abilities is by learning how to listen to others more effectively, by maintaining eye contact, not forming a response ahead of time, and by listening, trying to interpret a message without being biased. I will be able to develop my listening skill. Effective listening skills, they lead to being more productive communication and more successful interaction. By challenging myself and improving my listening skills, I will enhance my own personal leadership development in my organization and career. Taking the time to develop my personal leadership philosophy has allowed me to recognize what I value in leadership and how I envision a successful leader. This will help me recognize what skills and attributes I need to focus on in order to become an effective leader. Throughout this course of leadership and management, I've also learned more about myself, and I intend to take this newfound knowledge and apply it in my life and in my leadership journey. Throughout the course of this class, I've learned more about myself than I've ever before, and I intend to take my newfound knowledge and apply it to my life and my leadership journey. Thank you so much. I believe I deserve an A from this class. I have put a lot of time and effort, and I've learned a lot from this course, and I know I turned this in a couple minutes late because of due to different circumstances, and apologize for that, but thank you so much for everything, and have a great Christmas and Happy New Year.